Parotid gland. Anterior to parotid gland. Ramus of mandible with medial pterygoid muscle inserted on medial side of ramus. Masseter muscle inserted on lateral side of ramus. Vessel passing through substance of parotid gland. External carotid artery. Retromandibular vein. Parotid gland gives parotid duct. The parotid duct passes lateral to masseter muscle, then punctures the buccinator muscle and opens into oral cavity opposite to upper second molar. Posterior to parotid gland. Mastoid process of temporal bone with sternocleidomastoid muscle inserted on lateral side of mastoid process. Posterior belly of digastric muscle inserted on medial side of mastoid process. Relations of parotid gland. Anteriorly, ramus of mandible sandwiched between medial pterygoid muscle and masseter muscle. Posteriorly, mastoid process sandwiched between sternocleidomastoid muscle and posterior belly of digastric muscle. Styloid process. It has attachments of following muscles: styloglossus, stylohyoid, stylopharyngeus. Facial nerve. Exit through stylomastoid foramen between mastoid process and styloid process. Internal carotid artery. Internal jugular vein. Cranial nerve 9, 10, 11. Inside the carotid sheath. Cranial nerve 12. Medially pharyngeal wall. Facial nerve. It exits from stylomastoid foramen and enters the gland. It passes through gland anteriorly to supply muscles of facial expression. It does not supply parotid gland. It divides the parotid gland into two parts, superficial and deep. Therefore, it creates a surgical plane. Deep part of parotid gland, lymph nodes are less. Superficial part of parotid gland, lymph nodes are more. Parotid duct. Parotid duct passes lateral to masseter muscle. Punctures the buccal pad of fat. Punctures the buccopharyngeal fascia. Punctures the buccinator muscle. It makes a course and pierces the mucous membrane of oral cavity and opens opposite to upper second molar. Ear. Parts of ear. External or outer. Middle, inner. The ear has two main functions: hearing, balance. Outer ear comprises of auricle. External auditory meatus. Middle ear comprises of tympanic membrane. Three ear ossicles. Malleus, incus, stapes. Tensor tympani muscle. To tense the tympanic membrane and dampening of sound. Stapedius muscle. To hold back the stapes foot plates so that it does not keep vibrating on oval window or inner ear. Eustachian tube. It opens anteriorly into nasopharynx and brings air into middle ear cavity. Promontory. It covers cochlea of inner ear. Inner ear comprises of cochlea for hearing, vestibule for static balance or linear acceleration, three semicircular canals for angular circulation. Embryology of ear. Otic vesicle, first pharyngeal groove, surface ectoderm, rhombencephalon, first pharyngeal pouch, tubotympanic recess, endoderm of primordial pharynx. Otic vesicle, developing malleus and incus, first cartilage, developing stapes, second arch cartilage, tubotympanic recess. External auditory canal. It is formed by surface ectoderm of pharyngeal cleft or groove. Middle ear and eustachian tube. They are formed by endoderm of first pharyngeal pouch. Inner ear. It is formed by otic vesicle, ectodermal placode of surface ectoderm. Malleus and incus. They develop from secondary mesenchyme of first pharyngeal arch. Stapes. It develops from secondary mesenchyme of second pharyngeal arch. As the inner ear develops, there is formation of membranous labyrinth. It presents towards inside and is filled with endolymph. Bony labyrinth. It is petrous part of temporal bone. It covers the membranous labyrinth. It is filled with perilymph. Perilymph and endolymph are ultrafiltrate of blood. Embryology of auricle. Auricle is formed by first and second pharyngeal arch. First pharyngeal arch gives three auricular hillocks. Hillock 1, 2, 3. Hillock 1, 2, 3 form tragus, crus of helix, helix of auricle. Second pharyngeal arch gives three auricular hillocks. Hillocks 4, 5, 6. Hillocks 4, 5, 6 form the antihelix, antitragus and the ear lobule. Nerve supply of auricle. Great auricular nerve. It supplies most part of auricle